Hi, my name is Dawn Straight. Welcome to chapter 19. This is the day which the Lord hath made. We will rejoice and be glad in it. Next, a little history. We have been having health issues since we were first created. France took to living in caves and using plants as healing ointments. Then the Egyptians started drawing anatomies, they called it. This was before Christ, and they would do their surgeries from the drawings. And this went on before Christ and after Christ, and we still do drawings and use anatomy. And then all of a sudden, in 1970, we had the computers. And then in 1982, I took a job as a data input operator. And what I did is put the diagnostic code and the diagnosis into the computer. There was 5 of us input operators, and the information would go back into the room with a server and a printer, and it would print out all the information, calculate the fees, and make the checks for the doctor's offices. And I guess it was because the insurance companies had all the money that they had the technology. And now you know how old I am. And then in the 1990s, we got the HIPAA Act, and this was to protect our information electronically and otherwise. We have to sign release forms if we're taking our health information to one office to another, or it's being faxed. Then all of a sudden, we're in 2016 and almost 2017, and we have medical electronics. In the next screen, e-health. The use of electronics, information, and communication technologies in the field of healthcare. We have our EHR, is our electronic health records. This is an electronic version of patients' medical history records. And we have mobile health. That is, mobile health is the use, mHealth is the use of mobile technologies such as your cell phones, your tablets, for health communication and delivery of health information, health communication. Next, reasons for the growth of e-health. Well, just imagine, it's everything that we've been studying so far has led up to e-health. It's the conversion of digital technology. It's the digital revolution. It's the decreasing size of computers. It's the increase of phones and tablets. It's the increase in bandwidth speed. It's the cloud computing. Now, cloud computing is really easy to understand. It's server or computers or mainframes that are in a different place, in a data center with other mainframes and computers, and it's off campus of where your business is, and even some of your software is off campus, and that's basically what cloud computing is. Patients now have access to their own medical records. They can personalize their health care on the computer. The medical downloads are available. And with eHealth, we have some statistics. 75% of all U.S. Citizens have gone online for health information. Hospitals and office-based physicians are using eHealth records. It's tripled since 2010. I can go on and log in and get my records from my primary care and keep track of my lab reports and my visits. If I go to the hospital, I can come home and look up the procedures that they did and any lab reports that they did. So it's pretty interesting. Medical downloads are available, and eHealth funding surpassed $1.9 billion in 2013. Medical apps downloads reached 142 million in 2013. Next frame, mHealth or mobile health. Some more statistics. 52% of smartphone users have looked up health or medical records, and 19% have health apps. In 2015, smartphone apps helped the e-health industry connect to more than 500 million users. What do we use our smartphones or mHealth Thing 4. We use them for electrocardiograms. We use them for thermometers. We use them for hotlines for medical advice. We use them for access to health information. We use them for monitoring glucose. We use them for monitoring heart rhythms. We use them for gamification, which is playing games for to for a certain health behavior. You give them rewards and like badges and points if they win for interacting with health issues. This leads us to the next frame, which is electronic e-games, and they're electronic games to promote health and wellness. We have four areas of e-games. We have exergames, and that involves physical exercise such as dance. We have health and nutrition, which is involved in weight management and meal planning. We have brain fitness, which improves your cognitive functions. We have condition management, which is for your chronic health issues such as cancer. Next, health e-games. The leading ones are Nintendo, Sony, and Microsoft. They have developed console games and accessories that only provide entertainment, enjoyment, and also improve your overall quality of life, your QOL, by engaging consumers with health literacy and education to help them take control of their health through entertaining and interactive games. Next, let's talk about Nintendo because the president of Nintendo said that their theme is going to be health. From now on, their games, their entertainment is going to be health related. Their Wii Fit sold 23 million units worldwide. The next generation is going to be Wii Fit U, and it's going to have a wearable fit meter. Nintendo has also partnered with Bear for Children, the glucose monitor for diabetes. It's called Bear Digit, but it hooks into the Nintendo gaming system. Their entertainment is going to be improve the quality of life. QOL. Next, our healthcare companies are getting involved also in e-games. One such company is United Healthcare Company. They have made the e-game Dance Dance Revolution, which has fought child obesity. We also now have, next frame, wearables. The Proteus project in Europe was a t-shirt that a man wore that had a sensor under it and attached to him, and he had pulmonary disease, and they could monitor him with wireless monitor. His sensor had a wireless and was hooked up to a monitor and sent wireless signals to a monitor, and they could monitor his breathing. We have pedometers that can hook onto your belt zip, or it can go around your neck, or it can go on your wrist and measures your walking. We have wristbands that hook up to your cell phones, your smartphones, and it measures your steps. It measures your sleeping habits. It measures your physical activity, calories burned. We also have Google Glasses, which doctors use to monitor patients that are in remote parts of the country. They use them for viewing lab reports. They use them for live streaming for medical students. We also now have the dermal devices that attach directly to you, and they're used for precise monitoring. We have a chip tattoo, and that's used for ECG type monitoring and brainwave monitoring. Now, getting into developing countries, they are lacking severely in healthcare. But fortunately, we can help them out we have technology now with video conferencing. We have uploading of MRI or other scans to a cloud network, remote monitoring of vital signs at a distance and across the globe. I remember just probably about the 1990s, we only had about 3 MRIs, and now we have MRIs that go across the world. Telemedicine is being used where doctors and resources are not able to go. Unfortunately, U.S. healthcare is the most expensive in the world. By 2021, it will reach $4.8 billion. In 2010, we had the Affordable Care Act passed, where every person will be insured. Unfortunately, in 2009, we had a breach of protected healthcare information. We need to get stricter on that. Next slide, factors to watch. Convergence of digital technology. One thing that's coming in on diagnosis, they're not just diagnosing you by your symptoms, they're also adding your DNA now to it. In 2017, more than 3.4 billion smartphones will have access to mobile applications that will help you have access to health information. Wearable devices expect to hit 170 million by 2017. This is an 800% increase in 5 years. 100 e-health apps have received FDA approval and are expected to get more. E-health technology earned 26 billion by 2018 in the US. Will be from e-health will be from mHealth and the hardware. We have Google, Apple, Sony, and Samsung developing new communication devices for eHealth. Next frame. Our person of interest is Hallie Tecco. She was worried about getting information when you go out of state. I think today that you can just log in online to get your information wherever you are in the state, and probably even out of the country where there's internet access. And the pharmacies do pretty good to hook up to one another. The next frame is a man using mobile health. And then the last frame is a question. What was the first e-health product that you used? And what e-health product do you like the best and why? Thank you for your time, and God bless you.